We're back for another assessment video. This time we're going to be covering the musculoskeletal and neuro systems. And my patient Ryan is back with us. So we're going to start with musculoskeletal, and we're going to go ahead and inspect. So you always start with inspection. I'm going to be inspecting his temporomandibular joint, which is the joint that connects from your jaw, which is your mandible, to your temporal, but it doesn't exactly go all the way to your temporal joint or your temporal bone. It kind of just meets right here. So I'm going to point that out on my patient Ryan. So his joint would be right here. I'm going to inspect that. All right. And it looks like his his temporomandibular joint, they look very symmetrical. So we're just going to be checking for size, the contour, the range of motion, the symmetry, the color, make sure there's no deformities, like a fracture or dislocation or anything. So I'm going to go ahead and have him open and close his jaw to check for range of motion. So I'm going to have you go ahead and just like move your jaw up and down. All right. And it doesn't look like anything's wrong there, so we're good. Then we're gonna move on to the cervical spine, which is the part of your spine that's on the back of your neck. So I'm gonna test for his range of motion there too, and I'm just gonna have him touch his chin to his chest and move side to side. So go ahead and touch your chin to your chest and move side to side, or put your head up and then move it side to side. All right. And I'm making sure there's no swelling or anything as well. It all looks normal. So then we're going to move on to the shoulders. The shoulders, I'm going to have you go ahead and circle your arms for me to check for range of motion. Okay. And then put your arms behind your head. All right. And then put your arms above your head. All right, so he's got normal range of motion there. Now we're going to move to elbows. We're going to check the elbow, which is a pivot joint. So it can only go bend one way. It can only do flexion. So go ahead and flex your elbows for me on each side. Make sure you can move those. Okay, and straighten them out all the way. All right, so it looks good there. Now we're going to move on to the wrists. So I'm just going to have them move them in a circular motion, make sure they have normal range of motion as well. So move your wrists in a circle. All right. And then I want you to do supination. So supination would be like this, and pronation. Supination, pronation. So go ahead and do that for me and flip them. Okay. Okay, and they look symmetrical. There's no discoloration, swelling. He has normal range of motion. So now we're going to move on to joints in the hands and the fingers. I'm just going to have him wiggle his fingers and make sure that he can move those with normal range of motion. Okay, go like this. All right, looks normal there. Now we're going to go to hips. So he's in the seated position already, which shows that his hips are working and it's not painful. Is it painful for you to sit up like that?
No, ma'am.
Okay. And then I'm going to have him try to raise each knee, and I'm going to put pressure on the top of his knee to check for his hip joint. So go ahead and try to raise this knee. Okay, all the way up. Okay. Now this one, all the way up. All right, normal range of motion in his hips. And now we're going to move on to knees. So I'm going to have him straighten and bend his knees. Okay, so go ahead and those are pivot like your elbow, so it only goes one way. So go ahead and straighten your knees. Now bend it for me. Go ahead and bend it up to your, pull it up. Okay, now do the other one. And then pull it up. All right. Normal range of motion there. And his knees and his patella looks like it's not swollen and no discoloration, and they're symmetrical. Now we're going to move on to ankles. So I'm just going to have him circle his ankles around, and then I'm going to have him put them in a plantar and dorsal flexion position. So go ahead and roll your ankles for me. Okay, now do plantar, which is when you push your ankles down, and then dorsal flexion up. Okay, and he has normal range of motion in his ankles. Okay, now we're going to move on to the thoracic and lumbar spine joint. So that's going to be the thoracic is your spine in the middle, and then it goes down to lumbar. I'm just going to have him stand up and kind of twist side to side to show that he has normal range of motion there. So stand up and twist. Do, do. All right, looks good. Sit back down. Okay, and now we're going to move on to, so as I was doing all the inspection, I was making sure that he had normal range of motion in his joints and just checking for any abnormalities, which everything looked normal, so we can go ahead and move on. Active, so there's two types of range of motion. One is active and one is passive. Active is whenever they do it all on their own and they can move their joints whichever way without any help. And then passive range of motion would be when they need assistance or help from me to completely move their joints. So for example, move your head side to side. Okay, so he doesn't have any trouble doing that, but say that he had trouble doing that, I would assist him, and that would be passive. So pretend like you're having a hard time moving it this way. So I would like help him. Okay. And then that would be passive. Okay, so now we're going to move on to palpation. What I'm going to do is I'm just going to check for the temperature, make sure that his muscles, as I was going, I was already making sure that his muscles were firm, there was no atrophy. I kind of felt them already whenever I was touching him, and it wasn't super hot to the touch, super cold or anything. It was just like a normal body temperature. So that kind of was included as I was inspecting. But so now we're gonna, and I was checking for bony articulation. Bony articulation is just where the bones meet at the joints. So like in his shoulders when he's moving them and anything like that, I just like touch it to make sure that they connect and they're not out of place and there's no weird like popping or anything like that. So now we are going to go to the Phelan's test. This checks for carpal tunnel. And what I'm going to do is I'm going to have him put the dorsal part of his hands together and press down. So it's going to be like this. Go ahead and do this for me. And then kind of push your wrists together to check for carpal tunnel. And if he did have carpal tunnel, it would hurt and he would lose feeling and it would be kind of numb and there would be a burning sensation. But how did that feel when you did that? Did it feel normal?
Yes.
No pain or tenderness?
No pain.
Okay. And then the other test that you would use to check for carpal tunnel would be the Tinel's test. The Tinel's test, I would just tap right below the wrist with my pointer finger. So I would go like this, and then I would put my pointer finger there, and I would take the, what is it called? What is that called? It's right where the median nerve is, and it innervates the hand. So I would take what are those things called when you tap? The hammer, what is that called? I don't know. But anyways, so go ahead and give me your wrist, and I'm going to pretend like I'm doing the Tinel's test. So I would put my pointer finger right here, and I would tap. And if he had any numbness or tingling or burning sensations, then that would be a positive for carpal tunnel, but he doesn't have carpal tunnel, so it doesn't hurt. Okay, so now we're going to go to Neuro to check for his level of consciousness. We're going to check for his level of consciousness with the GCS scale, which in other words is the Glasgow Coma scale. The best score you can get is a 15. And it's just checking to make sure he's alert, oriented, and awake. So we're gonna go ahead and practice the GCS, and I'm gonna pretend like I'm walking into the room and I'm checking on his neuro functioning. So the first one we're gonna look for is eye opening. If his eyes are completely open as soon as I walk in the room, then he's gonna go ahead and get a score of 4 on the scale. And it's gonna be for spontaneous. If I walk in and they're already open, it'll be spontaneous, and he'll get a 4. So I'm gonna pretend coming in. Actually, lay on the bed.
Lay?
Yeah, lay down.
This way?
Anyway, just lay like that. Okay, I come in the room. I walk over. Ryan's eyes are awake. Hi, Ryan. How are you? Are you feeling okay today?
I could be better.
You could be better. Well, we'll get you there. Okay, so that's spontaneous. I don't even know if you could see me. That's spontaneous. And then say we walk into the room and his eyes are closed and I don't say anything. I don't use any speech, or I just walk in and I try to kind of like tap him to see if he reacts or opens his eyes, and nothing happens. So, I want her to be able to see you.
Can I lay down?
So lay this way. Okay, so I leave the room and I walk in. Can you see you? Okay, and I walk in and your eyes are closed. And he's not responding, he's not opening his eyes. So that would be, so then I have to resort to using speech. So I have to get his attention and see if he'll open his eyes if I say his name or just try to wake him up. So I'm gonna walk in, your eyes are closed. Ryan? And then his eyes open whenever he hears me. So he's responding to speech, and then he would get a score of 3 on the GCS on the GCS scale. And then the other way, the next score you could get is a 2, and that would be from pain. So he only opens his eyes if he feels some type of like pain. So say I squeeze his earlobe or I squeeze his fingertip and he's not responding to speech and he's not responding to anything else, then that would be a score of 2. So for example, say I walked in and my patient has his eyes closed, and then I'm like, Ryan, and he doesn't open his eyes. So then I pinch his earlobe and he opens his eyes, and then he's conscious again. So that would be a score of 2 for pain. Say that I did all of that. I said his name, I pinched his fingertip, and I touched him, and he did nothing. He did not respond. He did not open his eyes. That would be a score of 1. Okay, so then for verbal, if he's oriented, he'll be speaking back appropriately and correctly. So this is another way to test for level of consciousness. I would come in and I would say I was having a conversation, and I said, what is today? What is the day of the week? And you respond appropriately and correctly with?
Appropriately and correctly?
Yeah, what is the day of the week?
Tuesday.
Today's not Tuesday, is it?
No.
Saturday. Okay, let's try this again. Sorry. Okay, so what is the day of the week, Ryan?
Saturday.
Okay, so that would be, I don't know why I said Tuesday. So that means he's oriented. Say that I walk in and I ask him that same question and he's confused. What my patient is gonna say is he's gonna talk back appropriately but not correctly. So for example, when he said Tuesday, that's appropriate for what I asked, but it's not the correct answer. So therefore he's confused. So Ryan, what day of the week is it?
Wednesday.
Okay, so Wednesday. So today's Saturday, so that would be incorrect. Wait, is today Saturday? Yeah, okay, I keep forgetting. Okay, and so then the next one, and that would be a score of 4 for confused. It starts at a 5, so if he's oriented, he gets a score of 5, and if he's confused, a score of 4. And then the next one would be inappropriately, which you would get a score of 3. So that's when your patient doesn't make sense when you ask them a question. So for example, don't make sense okay, so what day of the week is it, Ryan?
2:30.
2:30. So that wouldn't make any sense. So that would be inappropriately. And then incomprehensible, which the patient would receive a score of 2, is when you can't understand them at all. So you ask them a question and they mumble or they say gibberish. So, what day of the week is it, Ryan? So he would mumble and it wouldn't make any sense. And then if they have no verbal response, you ask them a question, they say nothing. Ryan, what day of the week is it? So they don't respond at all. That would be a score of 1. Okay, so that's all for that. And then now we're going to move to motor response. So say that he obeys commands. Then he would receive a score of 6. So, say that I ask him, Ryan, can you please raise your right leg for me?
Yes.
Okay. So he obeyed commands, so that would be a 6. Localized to pain, which would be a score of 5. That's when you pinch, like say you pinch their finger, and then they reach over with their hand, and then they respond and react to that, the place that you're pinching. So he would reach over with his hand, and grab where I'm pinching. So give me your finger. Okay. Now reach over and try to like grab where I'm pinching, like it hurts. Okay. So that would be localized to pain. And then withdrawing to pain is moving away from wherever I'm pinching. So say I pinch his finger again, and you're gonna pull away. So that'd be withdrawing. And then decorticate is flexion to pain. So that would be a score of 3. Oh, I'm sorry. Withdrawing to pain is a score of 4 on the scale, and then decorticate or flexion to pain would be a score of 3. That's when you bring your hands to your core, because you're in pain, and then decerebrate, decerebrate, arms go back and out, so it's like this. And then that would be a score of 2, and then no motor response is a score of 1. And of course, orientation, to check for that, you always ask person, place, and time. So, Ryan, what is your name? Oh, wait. Hang on. Ryan, what is my name?
Paige.
Where are you right now?
The hospital.
And what time is it?
9:30.
Around 9:30. Okay, so he would be well oriented. And then could check for short-term memory is another thing that you want to check for. So for example, what did we just eat for dinner? Taquitos. Okay, we just ate that, so that would be testing for short-term memory. And then long-term memory, where did you go to high school?
Silver Creek.
Okay, so that was a while back, so a few years ago. And then we're going to go ahead and move on now to motor function. So one way that you would check for motor function is you would check their gait when they're walking. Say that you're helping them ambulate to the bathroom or back to their room. You would check their gait, and there's like a bunch of different gaits that someone can have. So if they're limping, if they're just walking kind of weird, if their toes are pointed in or out, that could be something in their gait. Balance, to check for that, you can have your patient walk on their heels or their toes. So can I go ahead and have you stand for me and check your balance? All right, so walk on your toes.
Like on the tiptoes?
Yeah, and walk towards me. Okay, and your balance looks good. All right, you're balanced. Okay, and now we're going to go to the Romberg test. So their hands would be to their side, their feet would be together, eyes closed, and they stand perfectly straight and they don't sway. So stand up for me again. Sorry, and I want you to close your eyes, put your hands to your side and your feet together. Okay. And check for swaying, and he's not swaying. So everything is normal, and that would be the Romberg test. And then to check for coordination, we're gonna do rapid alternating movements. So I'm gonna have him flip his hands back and forth on his knees. So go ahead and put your hands on your knees and flip them back and forth like this. But all the way. Yep. Okay. So that's one way to test for coordination. And then we're gonna do the rapid fingers to thumbs. So it would just be like this. So go ahead and touch your thumbs and fingers like back and forth as fast as you can. Yeah, just like one, like in order and then back. Okay, so that's another way. And then fingers to fingers test. I'm gonna have patient touch their nose and then my finger, and I'm gonna move my finger kind of in different locations as we go. So finger to finger. I want you to touch my finger and then touch your nose. And then keep doing that. Anywhere my finger goes, touch it and then touch your nose. Okay, so that was good. And then finger to patient's own nose. So I'm gonna hold, hands out and touch nose with, okay, close your eyes. Okay, and then do this. Wait, open your eyes.
And then keep my eyes open.
Yeah, or close them now, and then do it. And touch your nose with each hand. Yeah, same thing. Okay, so that would be finger to patient's own nose. And then heel to shin test. So he's going to have his heel on his knee, and then he's going to glide down to his shin and back up and down. So go ahead and put your heel on your knee, or either one. And go down, and actually we're going to do both. Yes. Okay, now do the other one. All right, so we have to check both sides and make sure that he's good on both sides of his brain. And then now we're going to test the filamic tract of the spinal cord. The patient is going to close his eyes, and then I'm going to use what I have, which I'm using a cotton ball, and I'm going to touch different areas of his body, and I'm going to have him say now whenever he feels the touch. So... Okay, so he said now every time I touched him, so that's good. And then now I'm going to have him differentiate between the sharp and dual touch. So I'm going to use, I didn't have a toothpick, so I'm going to use cotton ball and scissors. So close your eyes and tell me if it's sharp or dull.
Dull.
What?
Dull.
Okay, close your eyes.
Sharp. Dull, sharp, dull, sharp, sharp, dull.
Okay. Got me a little worried there for a second. Okay, and now we're going to go to the posterior column of the spinal cord. We're going to check for vibration, and I'm going to they use a tuning fork for this, but I'm going to pretend, and I'm going to make it start vibrating by hitting it on the heel of my hand. So I'm going to strike the tuning fork, and I'm going to put it on the bony parts of his fingers and toes. So that would just be like the bony right here and then his toes. That's checking for neuropathy. And then I'm going to ask when the vibration stops, because if I just ask them when I touch them, they might be able to guess. So we're going to say, when's the vibration stop? And I'll be able to feel it on my hand as well, so I'll know if it's accurate. I'm going to do both sides of each. So strike it. Let me see your hands. Close your eyes. Now, tell me when it stops.
Stop.
Okay.
I thought you were gonna take it off.
Okay, now strike, and then the other side of his bony hand.
Stop.
Okay. Now let me see your feet. Okay, close. Keep your eyes closed. Strike. Bony part of foot.
Stop.
Okay.
Stop.
All right. That's good. And now we're going to move on to hold fingertips with the sides.